How much longer do I have?
I'm terribly sorry.
It's so much harder than I thought it would. Cancer's in my bone.
And I'll lose it.
Like everywhere.
I won't let the cancer take me.
We can fight this.
You might not die.
You're okay, Dad.
Down in a second.
This video may save your life. Overlooking these symptoms may result in cancer going undetected and can be life-alerting. Cancer is a scary word enough, but when it seems to be detected only after the worst has happened, it is all the more terrifying. Unfortunately, in many cases, this is how it happens. Symptoms are ignored till the cancer is already in quite advanced stages, and by then, it can be too late to do anything about it. Often, when patients visit a doctor, the diagnosis might not be the end of the story. Doctors often admit that there may be other cancers undiagnosed and that these patients need to be screened for further cancer of any kind. In most cases, we don't think about cancer and thus don't bother with creating proper awareness about this very dangerous disease that claims thousands of lives every year. In this video, I will explain 9 common symptoms of cancer you probably ignore but must never ignore because early detection gives you the greatest chance for survival. I would suggest you visit a doctor if you face some of these symptoms. Number 1. Sudden weight loss. Most of us associate losing weight with getting healthier. Although most people with cancer will lose weight at some point, but when you lose weight for no known reason, without trying to lose weight, no dieting, and not exercising, it's called unexplained weight loss. According to the American Cancer Society reports, any unexplained weight loss of 10 pounds or more could be the first sign of cancer. This happens most often with cancers in the stomach, colon, liver, lungs, esophagus, or pancreas. Also, if you suddenly and unexpectedly experience a gain in weight, this too could be a symptom of cancer. Abdominal weight gain, loss of appetite, and bloating are common signs of ovarian cancer in women. But because cancer isn't known as a cause of weight gain that immediately comes to mind for most people, this symptom often goes ignored. So we advise you keep in mind that any weight fluctuation that can't be explained might be a sign of cancer. Number 2, mysterious pains. Sometimes you know how you hurt yourself. Maybe you overdid it at the gym, and now your muscles are sore, or you're being clumsy and walked into something that left you with a painful bruise. But when you don't know where this pain is coming from, or if you think you know, but it doesn't seem to get better, then it's time to see a doctor about your pain. Persistent pain is your body's way of signaling a problem, and that could mean anything from nothing to bone cancer or ovarian cancer. According to the American Cancer Society, most pains from cancer typically mean that it has spread. This is a good reason not to be stoic and to make an appointment with your physician. Cancer can cause pain in different ways, including a mass or tumor pushing on other areas of your body, the chemicals a cancer releases, metastasis, or spreading from where cancer started. Frequent headaches could indicate a brain tumor. Back pain could suggest breast, liver, or lung cancer. Chest pain could indicate lung cancer or leukemia. The stomach pain could be a sign of pancreatic cancer. Bruising could result from leukemia. Sores and even itchy patches of skin that last for weeks could be signs of skin cancer. If you're experiencing pain that won't go away, and you're not sure where it came from, your doctor can help with the best next steps. Number 3, thickening or lump in the breast or any part of the body. Often disregarded as just a lump, because most lumps are not caused by cancer. Cancers associated with lumps usually occur in the breast, testicle, lymph nodes, and the soft tissues of the body. A lump caused by cancer is usually irregularly shaped, hard, and firmly fixed under the skin or deep in tissue. Although they usually do not cause pain, some types of cancerous lumps are painful. Here are tips about body lump. Lumps in the neck could be a sign of infection or an early warning of thyroid cancer. Lumps in the testicle vary. A painless one could be a possible warning sign of testicular cancer, yet the lump could also be from an injury, fluid buildup, or hernia. It is hard to tell the cause of your symptoms alone, so go to your doctor for an exam. Breast lumps might be the hallmark symptoms of breast cancer, but most lumps aren't cancer. They're often fluid-filled cysts or non-cancerous tumors. Lumps under the arm should also be checked. Still, we recommend you see your doctor right away if you find any new or changing growths in your breast, just to make sure. Cancer lumps usually don't hurt. If you have one that doesn't go away or grows, see your doctor whether you feel it's cancerous or not. Number 4, fevers that don't go away. When your temperature goes up, it's usually a sign you've caught an infection, but some cancers can also make that happen. If you have a fever that doesn't go away, it could be more than a raised temperature in response to a cold. Some cancers and tumor types are well-known causes of fever. This type of cancer includes lymphoma, leukemia, and kidney and liver cancers. They can harm your immune system and make it harder for your body to fight off infections. Sometimes flu-like symptoms accompany this fever, which can make you even more likely to ignore this sign because you attribute it to a non-cancerous cause and you believe it will clear off by itself. But if these symptoms linger or get worse instead of better, it could be a clue that you're not just suffering from a cold. Here are some peculiar instances of recurring fever that can foretell a possible cancer connection. You should pay very close attention if a fever happens mostly at night, you have no other signs of infection, or you experience night sweats. Number 5, persistent cough. A cold or the flu can make you hack away. Sometimes you get over the rest of the cold but can't seem to shake that nasty cough. This could be the case at times, but your cough could also be a cancer symptom, especially when accompanied by red flags like chest pain, weight loss, hoarseness, fatigue, and shortness of breath. Unfortunately, an ongoing, ever-persistent cough could indicate cancer in your lungs, larynx, thyroid, lymphoma, or leukemia, especially if you're coughing up blood. If your cough hangs around for longer than a few weeks and doesn't seem to improve with antibiotics or other medical interventions, your doctor may order diagnostic imaging of your chest to rule out cancer, especially if you're a smoker. Number 6, fatigue. This isn't exhaustion, similar to how you feel after a long day of work or play. Extreme fatigue that doesn't get better with rest can be an early sign of cancer. It is one of the most common symptoms of cancer. Although there are lots of underlying causes of fatigue, many of them are not cancer-related. If your symptoms are severe enough to affect your quality of life, call your doctor. You see, cancer uses your body's nutrients to grow in advance, so those nutrients are no longer replenishing your body. This nutrient theft can make you feel super tired. If changing your activity level or getting more sleep doesn't make you perk up, see your doctor. Number 7, skin changes. Our skin is the largest organ of the body and can be a window into our overall health. Jaundice, yellowing of the eyes or fingertips, is one symptom that could suggest a possible infection or cancer. Contact your doctor if you notice any signs of jaundice. A telltale sign of skin cancer is a growth that starts to look different or sore that doesn't heal. See a dermatologist for any spot that gets bigger or thicker, changes color, has an oddly shaped border, or you discover crust or scabs over a spot and it doesn't heal. Changes in moles on the skin can also be a cause for concern. Call your doctor if a mole is asymmetrical or has jagged edges, has irregular borders, changes its color, or gets darker, or if your mole is large and growing. Changing your fingernails should also be not overlooked, as it can show us signs of cancer. Blue, brown, or black lines and dots under your nails could suggest skin cancer, possibly a deadly form. A change in the shape of your nail, known as clubbing, might indicate lung cancer. If your nails look pale or white, you might have liver cancer. Number 8, changes in bladder and bowel habits. Bladder and bowel changes might be uncomfortable to talk about, but that's a big reason why so many people ignore them. Don't let embarrassment about your symptoms and changes in your bathroom habits stop you from seeing a doctor. If you notice any sudden changes in bowel and bladder habits that you think are not regular for you, including diarrhea or constipation, or a change in the consistency of your stool and a feeling that your bowel doesn't offload, these could be signs and symptoms of colon cancer. In a study conducted, people with cancer often experience changes in timing, amount, or size of their bowels. While these disruptions are usually caused by certain foods or medication, if you notice it happens regularly over time, it could be a sign of colon cancer. Because urinary tract infections are common in women, These symptoms associated with changes in bladder habits are often disregarded as just another UTI. But whether you're male or female, if you notice blood in your urine, experience sudden urgency, or feel a pain while going, definitely bring it up to your doctor to rule out cancers of the bladder, kidney, or prostate. Number 9. Bleeding. Coughing up blood can signal lung cancer. Blood in the stool could be a sign of colon or rectal cancer, and you may need a colonoscopy or other tests to find the problem. Women who experience unexplained vaginal bleeding should be checked for cervical or endometrial cancer. Also, a bloody discharge from the nipple can signal breast cancer. Blood in the urine or semen might also be a symptom. A pink, brown, or red tinge to your pee or semen is usually nothing to panic over. Infections, kidney stones, injuries, and non-cancerous prostate growth can cause bleeding, but less than often, bladder or prostate cancer might be to blame. Your doctor can do urine tests and other exams to find the source of the blood. Any and every unusual form of bleeding requires consultation from your doctor. Be careful not to self-diagnose or ignore the situation. Although these are not all the signs and symptoms of cancer, this is all we can cover today. Let us know some signs and symptoms to look out for. Hope you enjoyed the video. As always, stay safe and stay healthy.